This Heart Healthy education session is on exercise and vascular health. On the agenda today, we will be reviewing vascular disease. We will be discussing the benefits of exercise for vascular health and reviewing the exercise guidelines. Let's start with understanding vascular disease. Your vascular system is your body's network of blood vessels, including arteries, veins, and capillaries. The term vascular disease is used to describe a variety of conditions whereby the system is impaired in some way. Some common conditions are cardiovascular disease, peripheral vascular disease, cerebrovascular disease, aneurysm, varicose veins, and Raynaud's disease. Cardiovascular disease is an umbrella term used to describe a range of conditions involving the heart and the blood vessels that supply it. Such conditions include coronary artery disease, heart attack, heart failure or cardiomyopathy, heart valve disease, and irregular heartbeats or arrhythmia. Artery disease can occur anywhere in the body. Artery disease includes narrowing of the arteries, usually from plaque buildup. It may also include hardening of the arteries, usually from scar tissue development after damage to the artery lining, such as from high blood pressure, diabetes, or smoking. Weak, leaky, or ruptured arteries, which can occur from damage to the arteries from high blood pressure, smoking, diabetes, or genetics. Spasms or tightening of the artery walls, which causes the arteries to tighten and reduce blood flow. Spasms can be triggered by smoking, extreme cold weather, stress, and some other stimulant drugs. As previously mentioned, artery disease can occur anywhere in the body. As a result, the impairment will depend on the location of the artery disease. If artery disease occurs in the brain, it can lead to a stroke. In the heart, it could lead to a heart attack or angina. In the kidneys, it can cause chronic kidney disease, and in the legs, peripheral vascular disease. If artery disease occurs in the heart, it can prevent blood flow to the heart muscle. Decreased blood flow to the heart may cause chest discomfort, also known as angina, shortness of breath, or other related symptoms. If blood flow is significantly reduced and not resolved quickly, the heart muscle may be damaged, which is known as a heart attack. The severity of the heart attack will depend on the location of the artery problem, the duration of time left untreated, and the health and fitness of the heart and body pre-event. We will discuss the role of fitness in heart health shortly. Another form of cardiovascular disease is a condition known as heart failure. Heart failure is a progressive condition where the heart is not able to pump sufficient blood to meet the demands of the body. Heart failure may be a result of impaired heart relaxation, impaired contraction, or both. For more information on heart failure, be sure to check out the heart failure section on our website. Your heart contains 4 valves. The purpose of these valves is to ensure blood flow is continuous and unidirectional. If the valve does not open or close properly, proper blood flow to the body is impaired. If not properly managed, heart valve disease can lead to heart failure, stroke, or a heart attack. Interruptions to the heart's electrical system can lead to arrhythmia. There are many factors that may impact this electrical system, including coronary artery disease, high blood pressure, diabetes, smoking, and stress. A slow heart rate is referred to as bradycardia. A fast heart rate is referred to as tachycardia. And a common rapid or irregular heart rate is known as atrial fibrillation, or AFib. Let's now take a look at exercise and vascular health. Risk factors can be divided into 2 categories, those that you can't control and those that you can. Non-modifiable risk factors include gender, age, and genetics. Luckily, there are many factors which can be controlled, as listed here. Making changes to your lifestyle is a proven method for reducing your risk of developing cardiovascular disease. Having a look at the modifiable risk factors listed here, which do you think has the greatest impact on living a longer, healthier life? If you answered fitness, you are correct. Fitness is developed over time with regular cardio-based exercise and resistance training. The higher your overall fitness, the lower your risk for developing heart and vascular disease and other chronic conditions such as diabetes. Higher fitness is also linked to lower mortality or death rates. Now let's have a look at how exercise actually works to reduce cardiovascular disease. Exercise stimulates the growth and formation of new blood vessels. The formation of new blood vessels as a result of exercise acts as a kind of natural bypass, whereby the newly formed blood vessels bypass the blockage to restore blood supply. For many individuals living with artery disease, regular exercise, dietary changes, and medications can stop the progression of further artery disease and restore normal blood flow to the heart muscle and body. Not only can exercise form new blood vessels, but it can also widen existing blood vessels. Wider blood vessels make it easier for the heart to pump oxygen-rich blood to the body and muscles. This reduces the workload on the heart and makes day-to-day activities significantly easier. Exercise promotes regression of plaque in the arteries. Small changes to plaque can result in significant improvements to blood flow when coupled with increased artery size. This can increase blood flow to the heart and body. Exercise also raises good cholesterol, or HDL, and can lower bad cholesterol, or LDL, which can reduce plaque in the arteries. When you exercise, your muscles require fuel. This fuel can come from blood sugar. Therefore, exercise improves blood sugar control by helping blood sugar leave the bloodstream and enter the working muscles to be utilized. Since uncontrolled blood sugar levels can damage the arteries, blood sugar control improves the health of the arteries. Exercise can also burn fat cells for fuel. This can improve waist circumference and can reduce overall inflammation in the body. Exercise improves blood pressure control by causing an increase in the diameter of the blood vessels. Wider blood vessels reduce the internal pressure on arteries, which prevents artery damage. Exercise also improves almost every system in the body, including the lungs, brain, kidney, and bones. Let's have a look at general exercise guidelines. Aerobic exercise refers to activity where you are maintaining an increased heart rate for a continuous period of time. In regards to frequency, aim to complete aerobic exercise 5 times per week. The intensity should be moderate to vigorous, which correlates to an RPE of 12 to 14. Intensity can also be monitored with heart rate. Aim to complete 150 to 300 minutes of aerobic exercise per week. In regards to type, there are lots of options. Make sure you choose an activity that you enjoy. Resistance training should be completed 2 to 4 days per week. In regards to intensity, your muscles should feel fatigued after completing 8 to 10 repetitions of an exercise. On the RPE scale, resistance training should be a 15, or hard. The time of your resistance session may vary, but should take at least 15 minutes. There are plenty of equipment options for resistance training as listed here. You can also complete resistance training with no equipment using your body weight. To summarize, I want you to think of one thing you learned from this presentation. Hopefully you have gained an understanding of what cardiovascular disease is and how participating in cardiac rehab can reduce the risk of disease development and progression. Aim to complete 150 to 300 minutes of aerobic exercise per week, in addition to 2 to 4 days of resistance training. And remember that any type of movement is better than nothing at all. For more information, speak to your exercise therapist. Visit our regional website, gethearthealthy.ca, to join our live warm-up and resistance training sessions. Be sure to check out the exercise demonstration section on our website to view warm-up and resistance training videos. Thank you very much.